It's a balloon catheter that is used to measure the diameter and the pressure inside the esophagus.
Okay.
So Dr. Cetera is generally using it for patients that he's trying to decide whether or not he wants to do a POEM. Dr. Conklin is using it for patients where he's done a manometry, but the results are kind of borderline, or maybe he needs some additional information. So he'll do a Endoflip on top of a manometry, or in addition to a manometry. Some of the other physicians may be using them as a first line when a patient comes in with dysphagia and they want to see how tight is the esophagus, or is the lower esophageal sphincter so tight that it may need Botox or myotomy or something like that. So several different ways to use it, but it's all basically measuring the pressure and diameter inside the esophagus. The equipment that you'll need is this this whole tower, and then you'll need the Endoflip balloon catheter box. Inside a brand new box, I'm going to show you over here. Inside of a brand new box, you have enough to do 5 cases.
Okay.
So there should be 5 catheters, and underneath there should be 5 syringes.
I see.
There's 2 different sizes. There's an 8 centimeter length balloon and a 16 centimeter length balloon. In general, Dr. Cetera is using the 8 centimeter, but there are certain cases where he wants the 16. In general, Dr. Conklin is using the 16 centimeter, but every once in a while he wants the 8. So it's important to stock both.
Okay.
It's not obvious on the box which size is which. The order number, this one says EF-325N. This one is the 8 centimeter balloon.
I see.
The 16 centimeter would say EF-322N. So I would recommend just writing or putting a sticker or post-it on the outside so that you don't have to work too hard to figure out which one it is. But when you open it up, you want to make sure that the syringe that you're using, everything that comes from the same box should all say EF-325N, EF-325N. You don't want to mix and match the sizes of syringes with the sizes of balloons. So these are the 2 things that you'll need out of this box. This, if there's others, that's good for other cases. We'll go over here. We have to turn it on the back. So there's a power button here.
Okay.
So I turned it on. It makes a beeping noise. This one, the power button is on the front. I press this touch screen right here. And then these additional buttons will light up, and that's how you know the screen is about to boot up.
Okay.
It takes a minute. It's black right now.
Okay.
This is dark right now, but everything should light up. So you'll see Endoflip on the top, and you should see Endoflip light up here. This box down here, this you don't have to turn on. It won't ruin your procedure if you don't turn it on. All this does, the power button is on the back.
Okay.
What this does is it gives you the ability to record whatever is happening on this top screen. You can record it on here. So this is an optional feature. Dr. Conklin tends to like to record his cases. I think Dr. Thacker also records his cases. Dr. Cetera in general doesn't really record his cases unless it's something out of the ordinary. So it's just a nice to have. But if you do want to use it, turn this one on separately as well. So the first thing you want to do after you've identified which size balloon and you got the balloon and the syringe ready is you want to tape this to the front of the cart. This is just to give your balloon a place to live. So if this is a real patient, I would put gloves on because this balloon goes inside the patient, but obviously this is just an in-service, so we don't have gloves.
Okay.
So I'm just going to tape it onto the front of the cart. This just gives the balloon a place to live during the procedure. The next thing I want to do is I want to take this out. There's 2 pieces of trash or protective covering that you need to take off and throw away.
Okay.
One is this sleeve over the balloon. It protects the sensors in the packaging, so this is now trash.
Okay.
And the other thing you want to take off is this pink spongy thing. This protects the catheter electrode card in the packaging as well. So you want to take this. Protective sleeve is off. It's just the bare balloon. You're going to put it all the way into this calibration tube, all the way down to the bottom. And then now it says, during initialization, ensure the syringe is not inserted and all staff is clear of the unit, and then press continue when ready. So that just means don't touch this pump arm right here. Press continue. The reason why is because this needs to move back and forth freely as it adjusts on its own. So we don't want to bump it or prevent it from moving back and forth. While I'm waiting for that, I'm going to grab an alcohol swab, and I'll take this, and I want to wipe these gold, I don't know if they're electrodes or what they are, but we want to wipe those gold pieces flip it upside down so the green dot faces the green dot here, and plug it straight in. Oops. We want to plug it in when it's still wet. It seems counterintuitive, but we want to plug it in when it's still wet because it helps the machine read the card, and the card tells the machine what size balloon you just plugged in. If you get this high pressure alert, just press continue to bypass it. Now it'll say new catheter detected. Do you want to continue with the current patient or enter new details? We're going to say new patient. You always want to click delete and continue. The other option is archive and continue, but you will never do that. Always click delete and continue. So now here's where you'll enter the MRN number under the ID. You have the option to put the last name, gender, physician name. All of this is optional. The only thing you need to fill in is the MRN number, but it won't check your work. So 1, 2, 3, 4, 5, 6, 7, fake name, a fake number, whatever. So I'm not going to spend the time putting in all the other fields. You can if you want to. I'm going to press continue. So now the last thing to do, where did I put my syringe? The last thing to do is to get the syringe ready. So it looks like this. First thing is I'm going to take this red cap off.
I see.
And I'm going to attach it to the catheter right here so that we don't lose any liquid. If we lose liquid in here, you can't refill it because it's not normal saline. This is 0.3% saline.
I see.
So we can't refill it with regular saline or normal saline. Sorry, I have it a little bit twisted. Now this syringe fits into this pump arm just like an inflation handle, just like a CRE handle kind of. So you fit it in here. So take a look at this. So this thumb ring goes over this circle, and then the wings of the syringe go into this slot. You want to push it all the way back, then you want to lock this in place by pushing this upward. So now this is perpendicular, and you want to lock this in place. You should hear a little click. Let me do that again. You lock it in place by clicking it over the wings of the syringe, and this is flush all the way to the left side right here. So now you also know that the syringe is engaged because there's a blue light that lights up the syringe behind it.
I see.
So you know that it's all complete, right? So now it says new catheter detected, prepare for pre-use check, remove the protective sleeve, which we did. Make sure that everything is connected, and then press purge catheter. So I like to just do one more check, locked, connected. This is in with no sheath, we're good to go. Now I go ahead, press purge catheter. If you get that high pressure warning, just press continue. This step takes 3 or 4 minutes or so, but you don't need to babysit it. You can leave and go get the patient or do what you need to do. At this point, what's happening is the machine is pushing the liquid into the balloon, and it's testing each of the sensors. There's 16 sensors on the balloon, and each of these numbers is the sensor reading. And what it's doing is it's filling the balloon up to a certain amount, a certain volume, and testing to make sure that each of the sensors can read the diameter of the syringe properly. So there's nothing for you to do, it's just the machine testing the balloon. So that's all that's happening here. I got a high pressure warning. I'm going to continue purge. When you come back, it should say that the catheter is ready for use. So we'll just wait a few minutes and let it do its thing. There's nothing for us to do at this point except for watch it if you want to. There's actually one other thing that you can do while you're waiting. We're going to go here on the top screen. We're going to press this ... show distensibility. It brings up this second column over here. So without pressing the ... we would only get the diameter millimeter column, but we also want the distensibility column because that's helpful for the doctor to see. So we'll back up a little bit and show you the entire machine so you get a view. I feel like we're cinematographers here. Okay, so this one says it's failed. Okay, if you run into this situation, then you would try again. It could be that my demo catheters sometimes have little leaks, and that's why they send them to us as demo catheters. But if this happens, if you get a case where it fails, what you would do is you would inflate the 8-centimeter balloon. You inflate up to 19 mLs to test it to make sure that it's still good. And the 16-centimeter balloon you would fill up to 29. So what I'm doing is I'm going to fill it to 19 and see if it's able to read. This is not a normal case scenario. It doesn't happen very often. So here, what I'm watching for is I'm going to watch to see this column. All of these numbers should be 14 plus or minus 1. So it actually looks okay. So I'm not sure why it failed in this case. But in this case, I would feel confident to continue using it. So you press deflate. So in a normal case scenario, when you came back to the machine after it purged, you would see a message that says catheter ready for use, purge was successful. So let's say this was a normal case scenario. So it's going to deflate on its own. Deflation is pretty slow. Okay, so it's deflating. Sometimes it continues to pull liquid out even after the syringe is done. It's like negative pressure. So before you use the balloon, you're gonna hold the balloon horizontally in the air. Back up so you can see how I'm holding it. You're gonna hold the balloon horizontally in the air without touching any of the sensors, and you're gonna press this pressure 0 button. What it does is it zeroes out the pressure because there's always a little liquid left in the balloon. So it's gonna zero out the pressure internally so that it can read accurately. You're gonna watch this button, and when the pressure 0 button comes back like it just did, then you can go ahead and use it. So at this point, you'll wait for the physician to tell you that they're ready to use it, and then he or she will say, okay, I'm ready for the balloon. This gets passed into the patient. It does not go through the scope. It gets passed alone or alongside the scope.
Oh, okay.
And then during the procedure, you will need to inflate the balloon to certain pressures. Back up a little bit so you can see the whole screen. So usually they'll inflate up to 20. You're gonna watch this. This box right here, this rectangle, is the amount of liquid inside of the balloon. So what it's doing is it's injecting liquid into the balloon, and you're gonna stop it when it gets to a certain volume. So the doctor should always tell you what volume they want, but usually they have you inflate to 20, stop, and then inflate to 30. So you see the balloon is growing.
Yeah.
If this was inside of a lumen, it would be. So we would stop at 30. So at this point, then, let's say this is inside of the patient. Let's say this is the LES. So they're looking at the reading. So do you see how there's an hourglass shape that corresponds to how I'm squeezing it? So pretend that's the LES. They may wait for the numbers to settle down a little bit. And then to the nurse in the room, they're going to read off a series of numbers. So physician will read out the balloon pressure, which is here. So in this case, it's 13.9. The distensibility is 1.5. And the diameter is 5.2. So all three of those numbers would be written down onto a worksheet, which we actually ran out on the cart, but there's more in the office. So then once they write those numbers down, then you go and inflate to the next amount. So in this case, it'd be 40. We went 30, 20, 30, 40. And at each point, you would stop it whenever the physician says that's the balloon volume that I want. So again, they'll read off the balloon pressure, distensibility, and diameter, and so forth. So you'll write that down onto the worksheet. When you're finished with the procedure, you just click deflate. You will just let it continue to deflate on its own. Sometimes the physician will pull it out of the patient before it's all the way done deflating, but continue to let the machine deflate even if it's out of the patient.
I see.
So at that point, if the balloon comes out, even if it's still deflating, you can coil it up and put it into the bag.
That's it?
Just like that. That's it. So at this point, usually the physician won't go in and use it again, but we had a case just now where the physician did a measurement and then did a dilation with a CRE balloon and then asked for the balloon again. So I wouldn't throw it away unless you're sure that they're done.
Okay.
So we'll wait for this to deflate and I'll show you how to detach and turn everything off. I also want to note that reading of the screen looks a little bit complicated for someone who's not familiar with it. The doctor should be reading the screen, so there shouldn't be a whole lot for the staff to support in terms of reading the screen. The staff's major involvement is setting it up with the pre-use check and then inflating and deflating during the procedure. But interpretation on the two screens, that's all up to the physician. So at this point, it's fully deflated. So to take it apart, we're just going to unlock, pull this out, and then pull this part out. So now this is all trash. We take this off, throw it away. To turn this off, you just reverse what you did, off, off. And then this one This one's a little bit annoying because there's a button on the back side of the screen. I press that,
Mm-hmm.
and then it brings up this power button.
Mm-hmm.
Shut down anyway.
I see.
You can wipe it all down. If this tube got dirty at any point, it's stainless steel, so you can autoclave it, you can steam sterilize it, whatever you normally do for stainless steel, you can clean it if needed. And that's it.
Okay. Can I stop it?
Mhm.